Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The feature presentation is COVID infection relapses after taking Paxlovid tablets. So, what is the story behind this? Is this real? What is causing these relapses? And how do you recognize that? And how do you treat that? And what is the significance? So, let us delve into the feature presentation. Paxlovid is a combination of two antiviral drugs, namely nirmatrelvir tablet 150 milligrams, two tablets in the morning and two tablets in the evening, a ritonavir tablet 100 milligrams once in the morning and once in the evening, and these have to be taken 5 days continuously. This is used as a treatment option for outpatient COVID patients only who test positive, who are in the early stages of having COVID symptoms. And it should be taken within 5 days after the onset of symptoms, and the course lasts for 5 days. May repeat the course at the doctor's advice, but this is questionable. This is not in the EUA, the emergency use authorization given for this particular pill, but nonetheless, this Paxlovid reduces symptoms, reduces hospitalizations, and makes patients feel better. And it is particularly useful in patients with compromised immune system and in patients with multiple risk factors like hypertension, diabetes, heart disease, heart failure, kidney problems, cancer, just to name a few. So this is how the box looks like, and you need a prescription from your primary care physician or a doctor to get these pills from the pharmacies, and they are readily available here in the United States. So what is a typical story of a COVID relapse after Paxlovid? As I said, Paxlovid is an antiviral agent. When we give this Paxlovid right after COVID onset, as you know, the COVID is created by COVID SARS-2 coronavirus, which replicates in the lung alveolar tissues and spreads to the rest of the body and causes all these symptoms. The function of the antiviral agents is to suppress the virus replication and thus minimize the spread of virus and symptoms associated with the COVID infection. So a typical story is you get a COVID symptoms and you do the rapid antigen test at home, which most people are doing nowadays, and you test positive, and you're having mild symptoms like running nose, headache, feverish, aches, pains. So you take Paxlovid for 5 days. 2 days later, you do the repeat antigen test, it comes back as negative, and you think, okay, all is well, I'm doing fine now, I'm going to get back to my normal activities. And a few days later, it could be 3 days, 7 days, or 10 days later, you begin to have similar symptoms of fever, aches, running nose, or maybe sometimes stomach problem this time. And now you begin to worry about it. You repeat the rapid antigen test. Sure enough, it comes back as positive. So what do you do? The answer is not that simple, because are you having a second infection? Are you having a recurrence of the infection? Or is it just the biphasic nature of the COVID, where you get COVID, they get better for a few days, then it comes back again, and eventually it will work its way through the body depending upon your immune system. But the question is, we want to know, what are we going to do if we test positive a few days after we took the Paxlovid, and now you're having symptoms and positive RAT tests. And this RAT test can remain positive for 1 to 2 weeks after the second bout of the COVID infection. So let us find out what is causing this relapse. My hypothesis is this. You are having a COVID infection. If you had not taken the Paxlovid, your body would have recognized the COVID virus because your immunity is down because your last booster was like 6 months ago. And so your body begins to respond to the virus in a normal fashion, and hopefully it will produce antibodies to fight the COVID virus infection. But on the other hand, when you give a medication like Paxlovid, which is an antiviral agent, it suppresses the virus. It may not totally eliminate the virus, it suppresses the virus. As a result, your body doesn't sense this antigen response from the viral particles. As a result, the body may not be responding immunologically to the infection, even though you are having a milder infection and the symptoms are controlled with the medication Paxlovid. So when you stop the medication, the virus may begin to replicate again, or you could be in the second phase of the COVID infection. As a result, now we are having the same symptoms, and when you do the test, it becomes positive. So the question is, does the Paxlovid really help in preventing COVID infection? Well, it does help in reducing the symptoms. It does help in making you feel better. It does reduce the duration of your COVID infection. But I'm not sure that it can totally eliminate COVID infection, because the moment you